Since I last spoke to you about the NHS in July, the latest board papers have come out, and they're showing 24,471 attendees in July 16, up from 22,716. Our local health service is under acute pressure. BHRT is missing all too many safety benchmarks. So again, firstly, I want you to, I'm requesting you revert to previous practice and take more than one question at Cabinet to improve local democracy. Firstly, will you agree with me that the BHRUT board should seek extra funding to allow them to reopen closed acute beds in the meeting tomorrow? The BHRUT should supply the benchmarks and comprehensive data for the recent trial of Queen's A&E in August, where sick patients were turned away to go to GPs. 3, that BHRUT should revert to previous practice and publish the number of acute beds at King George and Queen's hospitals each month. They've recently stopped doing that, which to my mind is a scandal. The Redbridge Clinical Commissioning Group should identify how many extra GPs need to be employed in the borough to end the current GP shortage. I would add that the Health Service Journal has recently reported that 2 London trusts did apply for extra money to open new acute beds, and they were successful. So there is a recent precedent, Leader. Thank you.
Thank you for your question or your statement. Can I ask the Cabinet member to respond, please?
In relation to your first question, Andy, I think we're going a bit further than actually simply just asking for money. We're involved in a piece of work around looking at a development of a business case around an accountable care organisation. So taking a whole systems approach to seeing how we can improve not just our health, but our health, social care and prevention activities. If BHRUT were to ask for extra funds, I wouldn't hesitate to support them, but actually it's a more complicated situation that will improve the health and well-being for our residents than simply just asking for money. Then it's a reorganisation of the system, and we're part of that and party to that and working hard to try and make that happen. Do I stop there, or would you like me to continue? In relation to the... You hesitated, sorry. In relation... I don't understand why you think that sick patients were turned away in relation to the project that happened at A&E. My understanding of the situation, and I took the time to ask and kept an eye on this because clearly people had concern. I asked about the protocols that were put in place in relation to this, and I also subsequently found out that it was a process and a method that came up, an idea that came up from public and patient engagement around supporting people to access care at the appropriate place and the appropriate venue, and people were assessed by medics, so and actually signposted on appropriately. I'm sure they will produce the report of that because it was quite a successful pilot, from what I understand, and I'm sure you'll get access to that information. In relation to the practice, I don't know why BHRUT haven't what information that you're requesting that they published they've stopped doing. I'm sure your conversations with them, they'll be able to answer your questions on that. And in relation to the CCG, again, it's not as straightforward an answer as let's just have more GPs. If that again, it's more complicated. It's a more complicated question, and we've been quite heavily involved in the primary care transformation plan programme that's going on within Redbridge to actually try and address some of the issues that lots of our residents are having. There's also lots of really good practice happening as well within primary care, such as the primary care hubs that people can get access to out of hours, really accessible, really good service that people had. We've got some really great projects like Project 1000, where people with multiple comorbidities are getting proactively case managed, and some real positive lessons around primary care practice that will be taken forward around it. So yes, of course there is an issue around primary care, but it's not simply just about getting more doctors. It's about looking at the more complex question about how we resolve those issues.